Of all the decisions that have been made since the beginning of this was one of the hardest because, well, we call them elective surgeries. As you know, they're scheduled surgeries, and they're all important. They're all medically necessary. They're all required. And canceling them to ensure that we have the appropriate space in acute care hospitals and ICUs, in critical care units, is a necessary step. It's a step that wasn't taken in other jurisdictions, which dealt with an influx of COVID-19 patients while their hospitals were at 100% capacity. That's not what we were prepared to do in BC, so we've prepared the situation. I would note that had that happened, then obviously that would have had implications for scheduled surgeries as well. But it's this very serious question, and I should say that in every hospital, assessments have been made because some surgeries defined as scheduled surgeries are urgent, especially in oncology, and so those surgeries continue to happen. But you're correct. We're talking about the cancellation of thousands of scheduled surgeries, which will tell you, and the opening up effectively of almost 4,000 hospital beds. That tells you effectively how seriously we take the situation, how seriously we take the need to be prepared, and how difficult these decisions are, not just for hospitals and for doctors and for nurses who are not doing the work that they were born to do, that they've done to restore life and movement to people who were waiting for surgeries. Not just to them, but of course the many, many people who will be affected about this in the days and months to come. And yes, in this area, as in many others, there will be once we get through this, and it's going to take a while, once we get through this, urgency in getting back to work in every area, and healthcare is one of the most significant ones. We operate this time of year in general, a healthcare system in the acute care sector at 103.5%, which means we're going to the max all the time. And so when you're operating as we are right now, with a total capacity of 64%, that tells you that we've had to make some significant steps. I think most people will agree they're the right steps, but they're not without consequences. And obviously, we're preparing, hoping for that day that will come when we'll be able to restore those surgeries and get back to work, because that will be a huge priority. And the cost of delay will also have been felt in the months where things are delayed. So my heart goes with them. I've been in touch with a number of people who face this circumstance, and I have to say many of them have been extraordinarily courageous, but also, obviously, they're worried and concerned and have all the same anxieties that we have about COVID-19.